Welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Today we're delving into the intriguing realm of early pregnancy ultrasound scans, a technology that's raising eyebrows and sparking discussions. These scans utilize high-frequency sound waves to peer into the secret world of the womb, offering a sneak peek at the developing life within. While celebrated for providing expectant parents with captivating glimpses of their soon-to-arrive bundles of joy, some skeptics question the potential effects of these scans on the delicate early stages of fetal development. Join us as we explore the blurred lines between excitement and caution in the world of early pregnancy ultrasound scans with a diagnostic radiographer, Uche Nonso Azubuine. I just need to be very careful with the names.
Yeah, you did well.
How are you doing today?
Very well, thank you very much.
Welcome to the studio.
Thank you very much.
Now, talking about ultrasound scan in early pregnancy, some persons are talking about the excitement it can bring, and of course, there are also talks about the caution. So, help us make sense of what ultrasound scan is and when should we begin to draw cautions.
Okay, ultrasound scan is the use of ultra waves, sound waves, particularly to visualize the internal structures. Okay. A lot of people feel scans are just for pregnancy, but you can actually scan almost every part of the body depending on the indication. But for the purpose of this discussion, we are focusing on early pregnancy, right?
Yes.
Good. So ultrasound scans are actually safe.
Okay.
At any stage of pregnancy. I don't think there is no known hazard in literature for now.
Okay.
Regarding ultrasound scan. However, the practitioners, the radiographers who do these ultrasound scans, sonographers too, are well trained to follow the guiding principles and all that, considering, that it's safe doesn't mean there are still little, say like heat. It doesn't have radiation.
Okay.
But a sonographer knows that the faster, the better. You just do your thing. There will not be need for any heat transfer from the equipment to the patient's body.
Mm-hmm.
All right. So, but for the purpose of saying, is there any hazard or not? No, no. It's safe.
Okay, so what information does this ultrasound scan provide?
Okay. We are focusing on pregnancy
Mm-hmm.
now. If a woman comes for an ultrasound scan, a pregnant woman, we are looking at the entire reproductive tract. But most importantly, we need to look at the uterus and assess what is going on inside there. Because it is expected that pregnancy should take place in the uterus. Why I'm saying this is because there is something we call ectopic pregnancy. You can also have pregnancy taking place in other areas outside the uterus.
Wow.
Yes, it could be in the adnexa. You can also find pregnancy taking place in the abdomen.
Where's the adnexa?
The adnexa are other parts of the reproductive tract of a woman that is not the uterus. So you have the fallopian tubes, you have the ovaries,
Okay.
right? Yes. So those other structures are where we call the adnexa. Yes. So you can have pregnancy taking place in those places, and it is risky.
Wow.
Yes. It's an emergency situation. It could result to an emergency situation if it's not detected early. That's why a woman needs to do an early ultrasound scan.
Okay.
Yes. You need to go. If a woman misses her period, there are other indications for early ultrasound scan. But for the purpose of finding out if there is ectopic gestation or intrauterine gestation. Intrauterine is intra inside the uterus.
Mm-hmm.
That is at the right place.
Okay.
Yes. Ectopic outside the uterus. Any other place that is not the uterus, right? So, for the purpose of knowing the right place, the woman comes in for this ultrasound scan. We look at the uterus to see. So, when we now find out that this pregnancy is going on inside the uterus, we say, we are good with this one, stage 1 passed.
Okay.
So we now start looking out for other things. We look at the ovaries to see if there are cysts. Cyst is a fluid-containing sac. It could be normal, it could be abnormal. All right?
Oh, okay.
So we look at the ovaries. Are there cysts there? Can we find solid lesions, like masses? We look at the uterus, the walls too.
Now, sorry to cut you.
Okay.
We don't know what lesions, because if you say lesion, we probably want to take it to the biblical sense, but we don't know what lesions are. So
okay, let's say a mass.
Okay.
A mass is something that occupies space.
Okay.
So anything that is not supposed to be there, that is occupying a space, that's what we call a mass.
Okay.
It could be a solid mass. Even cysts are masses.
Okay.
Yes, but they are fluid-containing masses, fluidy masses. All right. So we look at the ovaries, the uterus. We check the uterus to see if there are masses. Do we have fibroid masses that is coexisting with the pregnancy?
Oh, that's possible.
Yes. There are some persons that will come in. When you check, you see that they have very huge intrauterine masses. Yes, coexisting with this pregnancy. So when you find out these things, and this woman goes back to the gynecologist that is here and the obstetrician managing the patient, they will be able to know what's going on inside and render proper management for this patient. All right? Because sometimes these masses are symptomatic. For some persons, it causes pain for them.
Wow.
Yes. They are pregnant at that early stage, but they are feeling pain because there is something that's abnormal in there. So, boy, you need to know. Okay. There is no other way to know. You cannot use, except you want to use your spiritual eyes. But if you want to see what's going on there at that early stage, an ultrasound scan is very handy and it's cheap too. It's it's a very cheap way.
Because I was going to say maybe some people do not do ultrasound scan because they might be expensive.
You know, expensive is relative.
Yeah. So, and cheap too is relative.
Cheap is relative too.
Yeah.
Yes,
so,
but if you compare it with other modalities that have this capacity to look at what is going on inside there, you will discover that ultrasound is actually a very cheap method of assessing early pregnancy.
Okay.
Yes.
So what are the main benefits now that are associated with this early ultrasound scan?
Okay, I think I touched some of them when I was talking. If you discover an ectopic gestation very early, somebody could escape going into the theater. Medication could do.
Yeah, I think you mentioned theater while we're discussing outside this conversation.
But if it has gotten to the point when the patient needs to go into the theater for an intervention, you know, it's also in stages. Emergency can actually have stages like that. So for some ectopic gestations, you see slowly leaking. It's already bleeding inside. So you see that it's an emergency too. For some, you come and you notice that there are fluid, there is blood already inside the abdominal cavity. Really? Yes, in the dependent portions, you find blood everywhere. So it's a more serious emergency at that point. All right? So if ectopic pregnancy is detected early, it saves a lot of troubles, both on the part of the clinicians and the patient. It's also there is also cost benefit, right? Because it's not the how do I put it now? The financial aspects of the management won't be the same. Wow. Yes. So there is an economic importance to it.
Of course.
Yes. Even the psyche of the person, the pregnant person. When somebody walks in on their own and you check and you tell them, see, this pregnancy that you're expecting is actually not in the right position. They came in very stable. They were not working. Maybe like the ectopic gestation has started leaking, and maybe they faint on the road, and you're now carrying the person. When the person comes in, it's easier. It's easier for the clinician to talk to this person. All right? You understand? So these things are in stages. The psychological aspect, the financial aspect, and all that.
So that means that it is possible for the gestational sac to leak when it's not in the right position.
Yes. You know, when we do this ultrasound scan, the presentations differ.
That's what we want to understand, because it looks complicated.
Differ. Yes. The development starts with the gestational sac. So when you find it in location that is not in the uterus, at times we see like a huge mass. At times it doesn't really present like a gestational sac per se. All right? Because it's not in the normal position. There are some you will see, it has stayed there to a stage that the fetus is even, I've seen like 12 weeks, 14, 15 weeks ectopic gestation. You will see the baby jumping inside. All right? But it's not in the right position.
Wow.
You understand?
Up to 12 weeks.
Yes.
That means they wasted time.
Exactly. They did not come early for ultrasound scan. It wasn't detected early. So you can now imagine the time wasted, because you wouldn't allow the pregnancy to continue there. It's dangerous on its own.
Absolutely.
All right? So the earlier,
the better.
The better. That's what we're preaching.
So that means immediately somebody, if you probably get your home test kits and you discover your pregnancy, it's very important to go for an ultrasound scan. That's what you're saying now.
Yes. You know, when a woman misses her period, for a woman of childbearing age, we begin to suspect, is she pregnant? Is she not? Because the truth is, when a woman misses her period, it's not just pregnancy that will make a woman miss her period. There are other indications.
Oh.
Yes. There are other factors. Someone who is having a hormonal imbalance, it could affect the period. Even stress, intense stress, psychological or physical, could affect a woman's menstrual flow. All right? What again? Menopause. So there are indications of such. So when you go to a clinician, the clinician will assess, take history, all right? Possibly send this patient for an ultrasound scan. So when this patient comes, we'll check. We'll look at the uterus. We'll look everywhere. We'll check. We'll look around. And then report back. Then the clinician will now correlate our results with both laboratory findings and do the right thing for the patient.
You know, there's something that amuses me. Like, how is it now possible that you just get a machine and then the machine tells you the position of the baby, what the baby looks like? But most importantly, how does this machine now tell you when you conceived to now determine the gestational age of the fetus growing? You know, how does that even happen?
Well, a lot of persons have actually asked me this question outside here.
Thank God, and I'm asking you now because I'm sure our viewers want to know.
It's a very popular question. The truth is, ultrasound is operator dependent.
Okay.
Mainly operator dependent. However, sonographers, radiographers who do ultrasound are trained to understand what this machine is saying. All right. The truth is that if you look at the ultrasound machine, if someone places a probe on a pregnant tummy and it's maybe like sweeping, you may not really understand, except he tries to demonstrate for you to understand. In fact, it's easier. It's easier when the radiographer is demonstrating because he is the one who understands. All right?
Okay.
He understands what he's seeing and how to show you this image.
Even the image sometimes don't make sense.
So he will try to show you this image the way it will make sense to you. In fact, most pregnant women appreciate the cardiac pulsation more. It makes them happy.
Because that's the only thing you
yes,
can see.
When they see it
moving.
doing boom, boom,
the other
boom,
things don't
happy.
even, it doesn't even form anything in your eyes.
With technological advancement now, we have 3-dimensional ultrasound where you can do volume rendering.
What does that mean?
You can show the patient, the fetus.
Okay.
In 3 dimensions. So the baby will look real.
Oh.
Yes. If you are looking at the baby, you appreciate. It will show you the hands, the limbs, if they are complete.
Oh.
All right. But some of these checks for anomalies are usually done in 2nd trimester. Okay. I believe we are talking about 1st trimester for today.
Yes.
So for 1st trimester, you may not appreciate.
We might even take you into the 2nd trimester. It depends, because there are other questions that are still burning that I'm going to be asking you, but let's go.
Okay. So for 1st trimester, you may not really appreciate, for a patient, may not be able to appreciate some of those little, the limb boards and all that the sonographer is seeing and appreciating because of training.
Okay.
All right. So sonographers are trained. The training helps them to appreciate these things and then interpret. You scan and you write your report. So when you see the report, you can easily read it now.
No, not all. Because there are some codes that are representations. Right? Yes, but it's not easy for people to understand, and I'm sure our viewers can relate to that.
Yeah, that's true, but there is an opportunity for you to ask. If you go through your report, if you have an ultrasound scan done and you go through your report, you can ask your general practitioner, the physician that is handling the case.
Okay.
Yes.
But you were trying to explain the 3 ways that an ultrasound scan can be done.
3 ways?
Yes, you mentioned something like that. You said it can be done in 3 ways. The first is where the baby will look real.
Okay. Yes, I said there is technological advancement now.
Okay.
Yes. So if you're scanning with a 3-dimensional ultrasound machine, 4D, in fact, the 4D is for the volume rendering.
Okay.
All right. If you use 4D to scan, you will appreciate the baby more.
Oh.
We have 2D, we have 3D, 4D. Okay.
Okay.
I think that's where the one will have more in Nigeria now. The 4D scans, it's everywhere now in Nigeria. People go in, pay, you see your baby, they show you the face, show you the hands, the legs, and you're happy. You're happy. It's fun.
Absolutely, yes. I would agree with that. But you know, there are thoughts that because it's early, you probably shouldn't get a scan done because of, you know, some sort of exposure, maybe from the machine because you've gone too early. How true is that assertion?
That's not very correct. You see, in medical practice, when the gain outweighs whatever
the
disadvantage you are looking at, you take the gain.
Okay.
That's the code. So, but just like I said earlier, there is no known hazard that ultrasound brings. No recorded hazard from ultrasound, at least from the much we have in literature now. Ultrasound is safe.
Okay.
Even in early pregnancy.
Away from literature, experience, Ngo.
It's safe.
Okay, because most times some experiences are not recorded in the literature.
You know, academic exercises even have more details at times.
But you will never beat experience sometimes.
Yes, that's true. I agree. But ultrasound is safe. I am telling you, it is safe.
Okay, so
very safe.
Are there abnormalities that are associated with the fetal development that ultrasound scan can actually detect, probably even with the brain as early as that?
Okay, now it's good you asked this question because it made me to remember something I didn't mention earlier. Even at that early stage, you could detect what we call molar pregnancy.
What does that mean?
Molar pregnancy is an abnormality. it's related to placental problems and all that. The truth is, when you see molar gestation, the pregnancy is over.
What does that mean?
It's bad development.
Really?
And so that's how best I feel I can explain it, so that I don't end up using a lot of terms. The pregnancy is not forming properly. It's like a mole. You are having something like, how we describe it, we say a honeycomb structure. If you see a honeycomb, you will see like cystic pockets like this. So that's the kind of thing you find in the uterus. And that's the malformation that you see in molar pregnancy. So it's part of the things you can detect in early gestation. But aside that, there are other deformities. Towards the second trimester, you begin to appreciate the development of the fetus more. So you can look at the brain, you can look at the neck, you can look at the abdomen. The abnormalities are numerous. In fact, I cannot mention all here. There are some you will see, there will be no brain. All right?
Really?
Yes. What we call an encephaly.
Okay.
Yes. If you see an ultrasound, you will see that there is no brain.
Have you experienced that before?
A lot.
How come?
It's not even something that you cannot find. It's there. A lot of radiographers are seeing it every day.
But sorry,
okay,
I'm not trying to stop you from what you're explaining. Now I'm wondering, in that kind of situation, will that child be born? Will the pregnancy continue, or the person will be advised to?
The obstetrician will advise the patient on what best to do. So at that point, we'll move you to your obstetrician. The management continues from there. All right, but you don't expect anybody to give birth to a child without brain.
But
so that's an advantage.
I'm just speechless because I'm wondering how can somebody be pregnant and there will now be a baby without brain?
Sometimes you could find the abdominal contents outside. Poor development. Right? So these are things that ultrasound has been doing. Ultrasound has been helpful. So the earlier you discover, you see some people, they will not go for scan, they will send them, please go for second trimester scan, they will not go. Maybe during their third trimester, they will now land in the hospital. You can now imagine somebody having a baby with an encephaly that you can even detect around, say 20 weeks. The person is now coming around 34 weeks. Imagine the waste of time. It doesn't make sense. It doesn't make sense. So the earlier, the better.
So how early is early?
Well, if a woman becomes pregnant, she will go for booking in the hospital. She will register for antenatal. So it is the duty of the nurses and the obstetricians there to give this patient a request paper to go and do ultrasound scan. They know when to send. All right? But even at that, you will find women who walk into diagnostic centers and do ultrasound scan on their own.
Because I was about to ask that. Is it not something, a service you can you can request for without a doctor's order or something?
There are a lot of diagnostic centers in Nigeria. They run ultrasound scans. However, I don't think it's not out of place.
Okay.
It's not out of place. But when you go there, they will sit you down and ask you certain questions. They will want to know why you want to do an ultrasound scan. All right? Why do you want to do a scan? You will now begin to explain. I want to know this, I want to know that. You find a lot of Nigerian women, I want to know the gender. So they'll go and do gender, whatever, one shower that they do. So it's still part of it, but that's the fun part of it too. So ultrasound has been very helpful. That's the truth. So we advocate that people come for ultrasound scan especially pregnant women.
All right.
First trimester, when they send you, come. Second trimester, if they say, go for scan, go. It's very necessary.
All right, thank you so much, Uche. Let's go on a quick break. When we come back, the discussion continues. All right, viewers, let's go on a quick break. When we come back, the discussion continues. Stay with us. Welcome back, viewers. In case you're just joining us, it's still Healthy Living, or reaching you from the nation's capital, Abuja, and we're still discussing benefits of early ultrasound scan in pregnancy. All right, before we went on the break, you were talking about some of the benefits, but now let's talk about how many ultrasound scan would one need during the life of a pregnancy, because especially for expectant mothers, they have it in mind, but how many ultrasound scans do they need throughout the lifespan of a pregnancy?
Okay, for a normal gestation that is going the way it should go, and if there is no maybe like a coexisting mass that the obstetrician needs to be assessing, or if the patient is not bleeding, if there are no other indications for requesting an ultrasound scan, most times it doesn't go beyond 3 ultrasound scans. We'll send you first trimester, second, and third, if need be.
Okay.
Right? It's not like you start doing scan. No.
Some people just scan almost every 2 weeks.
But if there is need for that, they will send you.
Okay.
If there is an indication for an ultrasound scan, towards delivery, the 3rd trimester, it's possible for the obstetrician to say, please go and do a scan. We need to assess the heart rate of this baby.
Okay.
You will go and do the scan because they need it. All right? They could say, we are palpating, but we are not really, we need to be sure where the head of this baby is. You go for a scan. So if an indication comes up for that, they will send.
Okay, just because you said they need to detect where the head of the baby is. Usually, I see that when people go for ultrasound scan, there are these, I think there's an indication for single, multiple, bridge. What does all those things mean?
Okay. Single is that you have just one fetus inside. Cephalic is that the head is down. The head is towards the cervix.
Okay.
All right, the head is towards the cervix. That's cephalic. Breech is that the baby is not presenting with the head.
Oh.
Okay, it's not presenting with the head. It's presenting with any other fetal part. It could be the hand. It could be the bum. All right, that's breech presentation. We also have transverse lie. Transverse is that it's lying this way, across.
Okay.
The head could be on the right or on the left. So that's transverse. So these are ways we describe the position of the baby. Yes, in line with the maternal spine. So.
All right. So there's this question that most pregnant women tend to ask. Well, I also asked the question while I was pregnant. It is, why is it that today I came for an ultrasound scan and you're telling me, okay, your estimated due date is in 3 days.
Okay.
Tomorrow I'm here for an ultrasound scan and the results telling me your estimated due date is in 4 weeks. I'm not saying that much disparity, but why is it that it can't be certain? Today it's here, tomorrow it's there. Why does that happen?
The estimated date is not gotten through magic. What the radiographer does is to take some fetal measurements of some fetal parts.
Now, those measurements, you will have to explain what it is for us.
I will.
Okay.
So when the radiographer takes these measurements, the measurements gives an estimation of the fetal age. All right?
Okay.
So now, when they give you an expected date of delivery, most reports, if you look at them, you see plus or minus 2 weeks.
Yes,
that's right true. Up is an error margin, plus or minus. So your delivery could come 2 weeks before, it could come 2 weeks after. It can even come on that date.
Okay.
All right? That's science, because nobody is God. You could have your date and labor will come earlier than the date. You will not say you will not deliver because the date you have not reached the date. you will go in and have your baby. For some persons, even after the date, it could linger a bit and labor will come. So the way it works, that allowance is given, right? Because it's a scientific work.
Okay.
Yes.
So what's the measurement about? What does that measurement do?
We measure the head circumference.
Okay.
We measure the what we call it head circumference. We also measure biparietal diameter from here to here. The head circumference, right? The abdominal circumference. We also measure the femoral length. There are other measurements, but these ones that I called, once you get them, you can estimate the weight of the baby. So these measurements help us to get the estimated weight of that baby.
Because I was about to ask, what's the importance of measuring?
Yes.
It's not like you will be able to tell what the head will look like, what the neck will look like, or what the child will look like.
So these measurements help us to estimate weight.
Okay.
Yes. But for those in the labor ward, the midwives and the obstetricians there too, the head circumference is also important for them. They also need it.
What would they do with it?
Well, it's actually not within the scope of this discussion.
Okay,
that's
but
why
at
I
least we
wouldn't
need
want to
to
go
know.
into it.
Yes, but because you have mentioned it, we have to unravel that. So
No,
even
no,
if
no,
not
no.
as deep as we want to know.
No, I wouldn't want to go into that because it's actually not my field. But some midwives and some obstetricians will request for the head circumference. They want to know how big is this head.
Okay.
All right.
Is it because of the opening of the cervix, possibly?
Yes.
Okay.
So, for reasons best known to them,
okay,
when they request for it, we give them these measurements because we can assess it. Yes. We get the baby in position, place our caliper, and we get these measurements, and we send to them. You know, it's teamwork. This person will do his own. You pass to this person. By the end of the day, the patient walks home happy.
All right. So please discuss with us the benefits of detecting that early, fetal heartbeat in the ultrasound scan.
Okay. Anybody that is breathing is alive.
Oh.
Right? So if for any reason a fetus is not breathing, the baby is not alive. I have seen cases where people come and we discover, let's say you measure the fetus you are seeing inside and it's maybe like 8 weeks in size. But this woman is telling you that she should be around 4 months pregnant. So probably the fetus died earlier than she was thinking. It happens. You get? It happens. So that's why when they send, and again, women should also learn to monitor themselves, because things like this, if it happens, on rare occasions, you will not have maybe like vaginal bleeding. Sometimes the body gives off a sign. And when it happens, the woman should go to the hospital. A pregnant woman, if a pregnant woman sees blood, like notices spotting or bleeding, whether heavy or not, she is expected to visit the hospital. At least go and complain to your doctor. In most cases, these patients will be sent for ultrasound scan to check what is going on. Is the placenta occluding the os? Why is this bleeding coming? Is this baby alive? Because sometimes when the heart stops beating, especially in very early pregnancy, the one we call missed abortion. We call it missed abortion. So when this patient comes, once the heart is not beating, you check and check, wait for some time, you can't still find it. You see, the pregnancy will not continue. All right?
Yes.
Just like I said, the earlier the better. So the earlier you will notice, the better. So if there is any need for you to visit the hospital as a pregnant person, the person should do well to visit the hospital. And if an ultrasound scan is requested, it's better to be done. And the earlier, the better.
Now, some women believe that some children end up coming out and they have Down syndrome, they're autistic and all of that. Does early scan in pregnancy, reveal all of that too when it comes to viability of the health of the fetal?
Well, there is, every modality has limitations of what it can and what it cannot do. So there is a limit to what an ultrasound scan will tell you, in as much as there could be pointers to some of these things. All right. In second trimester, you could find 1 or 2 pointers that could lead to some of these things, but there is still limitations of this modality to where you can just come out and say this baby is coming out, that this baby will not be thinking properly, that kind of. So for Down syndrome, it's very slim. It's very slim. Pointers, just few pointers that this thing is pointing towards that this baby might. All right. So that's how we look at it. It will be very difficult for you to find a radiographer who will write for you that this baby is going to come out with Down syndrome. No, it doesn't work that way. Okay. Yes.
All right. So can you explain how else the ultrasound scan actually detects multiple fetuses?
When you put your probe, just the way you see that you have a fetus there, if there are 2, you will see them.
Also, it will already be there from the very first time you take a test.
Depending on how early. If the scan was done so early, it's possible to find 1 fetal pole, and maybe after like 1 week, if you scan again, you could see 2. It is possible. But it's rare. Yes. Most times you can easily identify the 2 fetal poles in the gestational sac. Right? If you have a good equipment, you can easily notice it at that time.
Some people believe that there are so many inconsistencies when it comes to ultrasound scan, because just the same way you see, people complain about the dates. Today they said it's this day and tomorrow it's another day. It's not the same day. The same thing happens when it comes to gender detection. I don't know if that is true, because I've seen women say, they told me it was a girl and I gave birth to a boy. They told me it was a boy and I gave birth to a girl. Can you please explain that to us?
I think I mentioned something in that line before now. I said ultrasound is operator dependent.
Okay.
Yes. So if you look around, you see that we have a lot of, would I call them quacks? Let me just try and be civil and good and nice.
But it's the reality. There's no better way to actually describe
them. There are people
them
who go through the back. I don't know how they try to learn and whatever, or whichever way. So if you don't get to meet the right professional to do this scan for you, well, I can't say much about the result. But the truth is, if you are being scanned by a seasoned radiographer or sonographer, detecting a male child, there are things you look out for. You look out for the phallus, you look out for the scrotal sac. You check for the testicles inside, the penile shaft of that baby. All right? So it's going to be, I don't know how it will happen that a baby you have seen inside, you've seen the penile shaft, you have seen the scrotum, you've seen testicles inside, and the baby will now come out and become a girl. It doesn't work that way. So I think the problem is the hand that did the scan. It has nothing to do with ultrasound scan. Yes. Sometimes it could even be error of typing. Yes. Sometimes it's typo. Human error can come into play. So these are I think human error for typing, human error for professionalism.
Interpretation, yeah.
Yes, that is interpretation, because it's possible to, if someone is not seasoned enough, and you could look at, you could just see the labia and call it whatever you like. You could say it's a man. Person could see the scrotum and say it's a female. So that one is professional. And
honestly, even the monitor does not even help you understand anything as the mother or the expectant mother or parent here.
I think the responsibility is more on the radiographer for interpretation, right? For this particular interpretation now, it rests more on the professional doing it. From the professional to the typist and all that. So ultrasound doesn't lie.
Okay, but then how early does it tend to detect the gender of the baby?
The truth is, to avoid some of these issues, usually from 20 weeks down, some persons will tell you that they will not say the gender at that point. They will allow you from 20 weeks, 24 weeks. Some will say come around 24 weeks for gender detection. But from 20 weeks, you can actually tell the gender of a baby. You can.
Okay, so because we're looking at the benefits of ultrasound scan in early pregnancy, so what other benefits and how does it, enhance the overall health of the expectant mother and the baby?
Bonding too. This feeling that, my girl, some would have even given the baby a name.
They'll start communicating.
Right? Yes, they begin to bond. Sometimes the baby is kicking. You find some mothers rubbing their tummy, calling the baby by the name. You see, it's psychological and it does wonders too. So if a woman goes for scan and the woman is watching the baby, you can see the lady say, hey, look at this. Yeah, see my baby's hand. Oh, the baby will raise the hand. Especially for people who go for anomaly scan. You see, they will show you the fingers.
Anomaly scan?
Anomaly scan is to check if there is a problem with the baby.
Okay.
I think I've mentioned it before.
Yes, you have.
But I don't
you just
think I
didn't call
this
it.
term.
Yes, that's why I wanted to know.
So, when they go for such scans, because it takes some time too, because you need to look at a lot of things, look at the breathing, it takes time. It takes at least around 30 minutes. So, all those display on the screen and you're explaining to the mother, it's psychological and it's healing, right? Yes. When you come out, you're happy. More like, it's like you have seen what's inside and you're now expecting this baby to now come out. It's a whole lot of good feeling.
I can tell that it's both good feeling for the mother and the radiographer because the way there's a way your expression has changed.
Yes, the profession is a very good one, such that some days you make diagnosis and they look at you as the devil. Some days some patients come to and you make diagnosis and they hug you. They are happy.
Of course.
Right? So that is what we see.
All right, I'm looking ahead. What advancements are we looking forward to in the field of ultrasound scan in early pregnancy?
Advancements in what aspects?
Artificial intelligence is here to stay. So when it comes to early ultrasound scan, what are you looking forward to?
We'll be looking at better image production. I think basically that's what we are looking at.
Something similar to the 4D you described earlier.
So we'll be looking at an image. If you take a picture with this, if you see people who have taken this AI picture that is circulating around now, if you look at the image quality and the one you take with your normal camera, the AI image is very superb. So if it comes into ultrasound technology now, it's going to be wow. Like it's almost as if the baby is outside. So I think it will be a good one too.
We look forward to it because most times, as people are believing, some persons believe that there is nothing that has an advantage that does not have disadvantage. So that's the reason why most persons religiously believe that ultrasound scan is not something to deal with. How do you handle people like that? I'm sure you must have had experience in your field.
Yes, on 1 or 2 occasions, because of programs like this, we have tried to enlighten as much people as they can. on one or two occasions, you still find people who come to the clinic and they have still this little fear. They ask you, you have to reassure and reassure and reassure before they relax and all that. But I think it's part of the job. It's part of our duty to continue to enlighten the general public, to reassure our patients, to keep saying it, that ultrasound is safe, and that the earlier you do your scans, the better. The earlier you make diagnosis, the better. In short, the earlier you make a diagnosis is the best. The earliest time that you've diagnosed anything to solve more than 20 or 30% of the problem than when there is a point that you make some diagnosis, it's almost useless. It would have gone aside pregnancy. Generally in medicine, the earliest, if you detect something early, treating it and managing it, it's easier. It's always better.
You know, you said something that the earlier you detect, it will save you from going into the theater. You said it while we were off air, so I didn't understand that, and I wanted you to explain that a little more.
Well, that's for the clinicians, but there are medications.
Okay.
Yes. At the earliest stage of an ectopic gestation, medication can do. So, but it depends on the time and what's going on inside. So that decision is for the clinician to make. Okay,
so you're not going to touch it at all?
No. Because even if I'm going there, we don't have all the time to discuss. It might be misleading to the public. They may not really. So we advise, when you get to the hospital, you listen to the professionals.
Okay.
These people are trained to guide you better. It's their job.
All right. So are there aspects that we've not touched when it comes to the benefits of ultrasound scan in early pregnancy that you may want to advise our viewers about before we round up the show?
Okay. Another benefit is, for instance, if there is placenta previa.
What does that
placenta mean? Placenta previa is when you have the placenta blocking the os. That is where we call the os. That is the exit between the uterus and the cervix. You know, if the baby is coming out, it's the os that will open now. The baby will now come outside. So that place now that the baby will pass through, if the placenta is blocking it, it's better. Though that decision is not made in very early pregnancy. The patient will be watched because of placenta migration. We'll be watching to see if the placenta will move away as the pregnancy progresses. But if it doesn't, this patient can easily be advised to have an elective CS. All right? Because with the placenta previa, vaginal delivery becomes a problem. There will be bleeding. Yes. So if this is detected, the patient will be advised to go for elective CS. So it's safer. Right? Yes. I think I didn't mention this when I was talking about the other one, and I just remembered now that you asked. So it's part of the advantages.
So your final advice to viewers, to expectant mothers?
My advice remains the same. If you're sent for an ultrasound scan, please, the earlier, the better. Don't go and drop the request form. Some persons, they will send them for scan, they will go and drop request form at home and tell you, no, that these people are disturbing them. No, don't disturb me. I've had 6 children before now. This 7th one, you're telling me to come and do scan early. They will go and sit down in the house. And after maybe like when the baby is 6 months, 7 months, you see them, they will reappear. It's not the best. It's not the best. Because sometimes when you do this scan, you could find something that will save both the clinician and the patient stress.
Thank you so much, Rad Uche Nonso Azubuine. Really appreciate you today. Thank you for your time.
Thank you.
All right, viewers, that's why we draw the curtains on today's show. We hope to see you again next week, and I hope you learned something. I am Olamide Alhassan. Bye for now.